Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. Welcome to episode 166 of the podcast for February 27th, 2013. My guest today is Julie Bartels, Executive Vice President of National Healthcare Information at the ThedaCare Center for Healthcare Value, which is, of course, John Toussaint's organization. He's been, of course, a previous guest on this podcast. In this episode, Julie and I are going to talk about their new program called the Healthcare Clinical Business Intelligence Network. And it might sound like a mouthful, but Julie's going to tell us about business intelligence today and how data and transparency relate to lean improvement and transformation efforts that are taking place throughout healthcare. And we're going to talk about why, as Julie puts it, the devil's in the details in making more data available for the benefit of payers and patients. So that's the theme of today's episode. You can go to leanblog.org/166 for links and more information. And you can find all past episodes, of course, at leanpodcast.org. Thanks for listening. Well, Julie, thanks so much for being a guest on today's podcast.
Well, thank you, Mark. I look forward to the opportunity to share some information today.
Yeah, I think you've got a lot to share. We're going to touch on related to the ThedaCare Center and business intelligence. Can you start off by giving the listeners a little bit of your background and what your role is at the ThedaCare Center?
Sure. My title is the Executive Vice President for Healthcare Information, and basically what that means is that I'm responsible for leading any of the initiatives related to transparency in healthcare for the center. My background is in large data and in market research. I have, over the years, worked with health insurance organizations in the area of product design and market research. And then most recently worked under the leadership of John Toussaint as the CEO of the Wisconsin Health Information Organization, which is the all-payer claims database for Wisconsin. John was chairman of the board, and I was lucky enough to have the opportunity to bring that organization from concept to reality, and then moved to the center to continue the work of really expanding concepts of transparency in healthcare to other states based on our experience in Wisconsin.
Right, and the Wisconsin Health Information Organization, it's a WIO, I sometimes hear it referred to. I mean, John Toussaint mentioned some of the efforts there. I know for sure in his most recent book, Potent Medicine. So yeah, there's I think some of the listeners who've heard John talk about this before might be familiar with that organization. So it's good to
great
know that.
Yes, exactly.
Your background.
Right. WIO is the acronym used. It's WHIO, and there is a significant amount of reference to it in John's most recent book.
Right. So this whole idea, information and data and transparency. These are all such important topics related to the important part of healthcare improvement and healthcare reform efforts. We'll probably get to talk about transparency, but we also want to talk about business intelligence. And I know you hosted the first Business Intelligence Summit through the center. So I wonder if you could talk about that and a little bit more generally about what is business intelligence, because that's something I'm not that familiar with, and I assume many listeners aren't either.
Certainly. So let me draw the connection between transparency and business intelligence as a starting point, and then we'll move in to more detailed information about our work in the business intelligence arena. Transparency is a word or a term that, at least in my opinion, is way overused today and completely underdefined. So the result of that, of course, is that everyone agrees it's really important. It seems hard to open up any kind of trade journal or any kind of political discussion without a real smattering of people expressing concerns and urgency about becoming more transparent in healthcare, but it's never defined. And as a result of that, it's really hard to have a meaningful conversation about the role of transparency in healthcare and healthcare transformation without that definition. So at the Center for Healthcare Value, we use the healthcare transformation model as our construct for all of our work, and that model says that transparency is a key component that feeds information into the healthcare delivery system so that they can redefine the way that they deliver care to focus on the patient and eliminate waste, and that redesigned care is then supported and sustained by a business or a payment model that pays for value and discourages waste. And that transformation model requires that transparency be defined in the following way. We need to have information that tells us about the cost, the quality, and the risk and the consequence. So for purposes of our discussion today, will be all of my comments will relate to transparency having that definition. And for all of the listeners, I would urge you to really think about applying this definition of transparency to all of the discussions you have about transparency. And what you find, quite honestly, is that there's a lot of talk, but there's not a lot of real robustness behind transparency discussions because people aren't thinking that broadly. And unless we have all stakeholders having that kind of information at their hand, that is, knowing cost, quality, risk, and consequence, we can't make value-based decisions. So in that construct, then, I started working with a number of the healthcare systems associated with the Theta Care Center of Healthcare Value through the Healthcare Value Network. And what I discovered was that, for the most part, healthcare organizations are not well equipped. They either don't have capacity or skill set or a combination of the two to really work with the data that they have to understand their own performance, let alone the performance of others who might be their peer group in the local area or across the nation. So that led us to the realization that we really needed to focus on the development of business intelligence capabilities within healthcare delivery so that they can work effectively with their data to inform the redesign of care. So that was a very long-winded answer to your question, but the issue here of kind of tying transparency or business intelligence to transparency is right there, that transparency is an essential component of the transformation, but until and unless healthcare delivery systems become proficient in working with data and using data strategically, which is business intelligence, we won't make much progress, and certainly not the exponential kind of progress that we need.
Mm-hmm. So if I hear you right, I mean, it sounds like transparency, when you say that's an overused term, I mean, maybe that's a real high-level goal, and is it fair to say maybe that the devil's in the details and that business intelligence is that more specific way of getting data and transforming it into something useful? Or
Yes, I would say that business intelligence is a very significant component of transparency. There are other aspects of transparency that deserve mention, however, and those would be the fact that we need some standardized measures of value that we can all agree this is what value looks like, and we also need to have some forum for sharing those measures in a way that's meaningful to all the stakeholders. So transparency itself is both a combination of the access or interpretation of the data, the measurements themselves that will impart what value looks like, and then a comparative value, that is, and then the last one then would be some kind of public reporting forum. Those three components are areas that we continue to push forward.
Okay, so then I'm curious to hear more about the summit that you had recently. I mean, one of the things that the Theta Care Center for Healthcare Value and the Healthcare Value Network have been really good at is bringing people together from across the country, across the U.S. and Canada, to collaborate on some of these important issues. So can you talk a little bit about the summit? What types of organizations were there? What types of discussions that you were working through?
Yes, I would be glad to. It was really a great event. We hosted at our headquarters in Appleton a group of 35 business leaders. These are primarily healthcare delivery system leaders, but we also included a set of other stakeholders to make sure that we had a diverse and robust conversation going on. So we included some health insurance organization executives, some technology executives related to software solutions that try to address business intelligence in healthcare. And we also had a few people who are data analysts who are really kind of down in the bowels of organizations and healthcare organizations trying to figure out how to deliver data in a meaningful way to the front line and to the executive suite. The purpose of this whole summit was to convene organizations together to talk about the idea that scientific thinking is at the core of all of our work here. We want to transform the healthcare system, and yet if we can't feed our scientific thinking with good and timely data, we struggle with a lot of guesswork. And when we have to guess, sometimes we guess correctly, and sometimes not so correctly. And so there is a whole emerging science around the use of data as a strategic imperative, rather than simply a software tool or a set of reports that are produced each month, but in fact actually incorporating access and meaningful interpretation of data on a near real-time basis at the front lines, so that we can constantly be seeing what's happening and understand how we can improve our work on a day-to-day basis. So
right.
the forum. Sorry, go ahead.
No, go ahead.
So the attendees at the session were very enthusiastic about the idea of discussing data, and had, I think, some real aha moments throughout the day. We had the good luck of having Gartner provide us with a keynote speaker who set the stage for the entire summit by talking about the fact that data is an asset, an under-realized asset in most healthcare organizations. And if we look to other industries to tell us what data can do to transform them, data is an enormously powerful resource. But data in a closet or sitting on a server, not accessed and not accessible through easy use tools, is really something that isn't, it's not leveraged. And he challenged the group to think about any other investment that you might have in an asset in your organization that you spent as much money on, that you protect as highly as you do data, and that you, through your strategic planning, never put it to work. It's oftentimes not represented at the executive table. Oftentimes the CIO reports through the CFO or is somehow disconnected from the business. And so there is a lot of investment for not a lot of return in most healthcare organizations, and that's what a good business intelligence strategy can do for you. So that was the framework under which we had the next 2 days of discussion.
Okay, when you talk about scientific thinking, I think listeners who are doing work with Lean will recognize that as a kind of a core part of the Lean philosophy of having a scientific method for improvement. And there's a lot of improvement activity, but I want to bring the discussion back to value. And you asked, what is value? Don Berwick at the IHI forum a couple of years ago talked about. He was talking about Lean, and he was talking about value. A patient's value health, quality of life, not just the activity that is the treatment they receive. John Toussaint talks about it as being quality and cost. We need high quality, low cost. That's value. So the work you're doing in the business intelligence front, when you talk about measures, is this kind of helping take value from something somewhat vague to something more specific, more measurable, so we can tell if we're making an impact with Lean? Yes,
definitely that's the case. And so when John Toussaint talks about the relationship of cost and quality, his definition of quality is fairly expansive and includes the perspective of the person who's making that value judgment. When we further explain that in a little more detail in our definition of transparency, we talk not only about cost and quality, but we talk about risk and consequence. And those are two aspects of quality that really hit home for every stakeholder. So if you think about something as simple as an office visit that occurs between a doctor and a patient, each one of those individuals coming into that encounter needs to understand cost, quality, risk, and consequence of the healthcare decision that's about to be made. The information that they need is unique to them. So what the doctor needs to know regarding cost, quality, risk, and consequence walking into that encounter is different than what the patient needs to know, but those are aspects of information that will really help them make a value-based decision. And so as we drive towards higher value healthcare and we think about how we can employ scientific thinking to help us achieve higher value healthcare faster, we need to feed it. We need to feed the whole process with good information that will allow us to be as eyes open as we can be at any point in time when we're making decisions.
And I mean, this seems like an important thing for patients to have information, data available to be able to make good choices, maybe about not just where to go have a procedure done, but if they should even if that procedure is even necessary or helpful. I mean, does it get down to a fairly specific level where, you know, I'm trying to figure out what this means in the future. Does this mean, you know, having better websites that patients can go to find, really credible, consistent data to help them make very specific individual decisions?
Oh, that's a great question. We haven't solved the issue of how do we get the right information to patients so that they put it to work yet. We're experimenting, and I mean across the industry, we're experimenting with ways to get consumers further engaged in the healthcare decision-making process. This doesn't presume to know what the form is or even the media, but it does suggest that patients desire to have that level of understanding when they are in a position of having to make a healthcare decision. And it goes beyond patients, quite honestly. The same criteria would apply to any healthcare decision being made anywhere throughout the healthcare continuum or vertically throughout the healthcare system itself. When healthcare delivery systems are considering the acquisition of additional clinics or the building of a hospital or the partnership with another specialty group, they're asking themselves what is the cost, the quality, the risk, and the consequences of this decision, and they would like to have that robust kind of perspective in order to make the decision. Those very same types of information are necessary when a patient or a caretaker is considering some type of treatment for a particular condition. So, those facets of decision making are present at all levels.
Mm-hmm. And I'm curious what your thoughts are on how the current health reform efforts, the Affordable Care Act, are either helping move transparency forward. How is what's happening in DC affecting the work that you're doing or encouraging it?
Well, I think that there's both there those positive and negative things that are happening, and there's a short-term and a long-term impact. Certainly, the fact that we are moving to electronic records is a positive. It will put data in play that has not been accessible before, and that's very key. That's a kind of a table stakes thing that we have to have. So electronic data is a good thing. The negative side to that is that we are not standardizing that data. Every EMR vendor has its own format, and they are installing those with great speed across the nation wherever they can. And so as a result of this, we'll have a lot of electronic medical records that do not necessarily easily talk to one another. So it will make the work of health information exchanges and other electronic exchange efforts more difficult. It'll just require additional work because we're going to have to restructure that data, and that seems opportunity lost to me. The other kind of short-term impact is that healthcare delivery systems are so engaged with the implementation of electronic medical records that they have little capacity for anything else. And the last thing I'd say about that is that the selection of the electronic medical records systems, working with the vendors, many of the healthcare systems are now feeling like they didn't really understand what the reporting limitations of these systems might be. And so there's work ahead that they didn't anticipate that will continue to drain their resources that could be applied towards the development of business intelligence, as they somehow have to build reporting mechanisms that will help them improve their work. A lot of the meaningful use requirements, the reporting requirements, are not sufficiently detailed to help a healthcare delivery system understand its own internal performance and determine where there are opportunities for improvement. That will require a whole nother layer or multiple layers of reporting, true business intelligence, for them to really see how they can change the way that they're delivering care to become higher value.
Okay. And for people there might be some people from outside of healthcare listening. Can you just describe briefly what you mean by meaningful use? Because there's kind of a specific definition to that in terms of healthcare IT.
Right. It's with a capital M and a capital U, and there are very specific reporting requirements that each of the healthcare systems who wish to remain portion or to deliver care to the Medicaid populations must meet. And those requirements actually demonstrate use of the electronic medical records rather than demonstrating the value of the information that is exchanged. So, for instance, in the first round of meaningful use requirements, healthcare systems simply needed to show that they had installed a medical records system, that they were doing some minimal exchange of information around prescription drugs, as an example. Whereas internally, they really need to understand who is prescribing what information or what prescriptions, what is the risk of the patients with whom they are prescribing that medication. Is there an opportunity for less use of high cost and substitution of generic drugs? That type of thing is far more granular than any of the meaningful use requirements for reporting. So there's another layer of reporting that they simply must engage in order to understand and improve their own internal performance.
All right. Well, thanks, Julie. And to wrap up here, I mean, I think it's really interesting to look at the broad range of the work that John Toussaint and now yourself and others at the ThedaCare Center for Healthcare Value are doing, and all these different dimensions. Because my own background and work mainly is in the health, lean redesign of healthcare delivery as one pillar. The center talks about transparency, payment reform as being two very important pieces that help support. I guess it all being mutually supportive. I'm wondering if you have any final thoughts about how this all fits together, and maybe from the context of, for the perspective of people that are doing work with lean healthcare redesign. Do you have any final thoughts on why they or their organizations need to also be paying attention to transparency and payment reform?
Certainly, I would suggest that if we are truly looking to transform the healthcare system in our lifetime, we're going to have to do things differently than we've done in the past. And if we do this by guesswork and we simply kind of throw things at the wall and see what happens, if we're really, really lucky, we'll find a few really gems that would be great. It will be very difficult, even under that circumstance, however, to see rapid adoption of them. We're going to have to actually feed this whole transformation process with facts and with experiments, and then to rapidly spread that information by sharing sharing the results in a way that is acceptable, meaning that it is actually kind of irrefutable in terms of scientific proof. So transparency plays a key role. One of the things that I would really want everyone on the call to know is that we, as a result of the summit, we are establishing a peer-to-peer learning network to deal with issues of transparency, particularly around business intelligence. And we are at the spot where based on our experience with the Healthcare Value Network, we understand that peer-to-peer learning can provide a very effective way to collaborate across healthcare systems in order to learn more and accelerate our own journey in moving forward on higher value healthcare. So anyone who's interested in learning more about that can hit our website or call directly. We are more than happy to talk about that, and that will be one of the ways that we'll continue to push this transparency issue forward.
Well, thanks, Julie. And the website for anyone who's interested in getting in touch is createvalue.org. Do you have any other contact info that you can share, Julie, or can people call the center?
Certainly, yes. My email address is jbartels, that's JBARTELS, at createvalue.org, and I would be pleased to talk with anyone around these topics.
Okay, well, great. Thanks. And again, our guest has been Julie Bartels from the Theta Care Center for Healthcare Value. I'm talking about transparency and business intelligence. Thanks for sharing what you're working on.
You bet. Thank you, Mark.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.